So if you're new here, welcome. Thanks for joining us. You can feel free to drop any questions that you have in the live stream chat box, and I will answer those questions. So over the past few days, I've been getting some really great questions. A lot of people are curious about certain diets and supplements. We've had a lot of questions about intermittent fasting and insulin resistance. So if there's anything that interests you, or if you had any questions or health concerns, just drop them in the comment box and I'll answer them. All right, so I have my whiteboard here. Why don't we talk about some things until we get some questions, and then feel free to ask anything. All right, why don't we talk about, let's talk about IBS, because I know on my YouTube channel, a lot of you have seen my video of the different types of poop and what that means. If you haven't seen that short, go check it out. It's one of my most popular videos on my channel. And I get so many comments about that, about different types of poop. So IBS has a lot to do with bowel movements, digestion. So let's talk about IBS. So what is IBS? It is irritable bowel syndrome. So basically it's a condition that consists of a variety of symptoms, and if you fall under those categories, you're considered to have IBS. So there's different types of IBS. There's the constipation type. So that would be IBS-C. Then there's IBS-D, which is diarrhea. C and D, and then the M, and that would be mixed. So these are the different types of IBS, or like what you would normally fall under depending on what your bowel movements are like. So with IBS, there's usually going to be a change in the consistency of your bowel movements from what used to be your normal. So maybe you're more constipated. So if you're constipated, that would be, I usually say if you're constipated, like you might not even be going every day, but generally constipation is considered then like less than 3 bowel movements in a week. Diarrhea, on the other hand, is when you're going way too much. So that is like more than 4 times a day.
Scoobity.
So, and then mix would be a combination. Now you can also have constipation. You could still go every day but be constipated. So if you don't feel like you've fully emptied your bowels, that's a sign of constipation. Or if you have really hard stools, is another sign of constipation. With diarrhea, it's going to be loose or watery. So if you're like having to go multiple times a day, it's not formed, things are just passing through you, that's considered the diarrhea. It doesn't always have to be complete liquid. It could even just be a lot of mushy stool. One of my patients once described it to me as like peanut butter stool, where it just came out in like a mushy pile. So sorry to spoil your appetite if you're eating peanut butter, but that's kind of what the diarrhea type. And then again, the mix is like a combination. So that's what IBS would be. And then there's also a change in, or there's also usually some sort of abdominal pain or discomfort with there. So all of these will have abdominal pain or discomfort. So usually that could be bloating, like really, really distended. If you're feeling very bloated, that's something that would happen with all of them. Okay, so if you guys have just joined us, hi and welcome. I'm Dr. Amanda, naturopathic doctor. If you're just listening, talking about IBS, this is Let's Talk Health live chat. If you're new here, if you're new to my channel, make sure to subscribe. I talk a lot about different health conditions. I come on live every day, so just feel free to jump on. Make sure to like the video too. It does help get it noticed across YouTube's live stream algorithm. So I would really appreciate that. Thank you so much. We are talking about IBS, but feel free to ask any questions that you have in the comments. I get a lot of really good questions from you guys, different questions about supplements, about nutrition, and or different health conditions. So feel free to ask anything. If you've just joined us, welcome and thanks for joining. We're talking about IBS right now, but you can ask me anything else that you want. So, okay. So we talked about IBS. There's constipation, diarrhea, and mixed. I'm curious, anybody that's watching right now, were you ever told you have IBS or no? Nobody right now, but if there's anybody that is just hopping on, if you've ever had IBS or told you about IBS, let me know. So what can we do to help with IBS? So why don't we call these remedies? So what are some remedies and some things that can help with IBS? So I'll talk about a few different things. One thing can be diet related. So generally the low FODMAP diet, and I'll write that down, low FODMAP diet.
What's FODMAP?
It stands for a variety of different simple carbohydrates that can be, when they're broken down, they can cause gas and bloating and irritation. So it's like fructooligodimonoallose or something. I can't remember exactly what the A stands for. And polyols. So that's basically what it stands for. It's like these little like when the carbohydrates get really broken down, they can cause some gas and bloating. So for example, dairy is in there because of the lactose in the dairy. So dairy would be one of them. Even things like apples, like too many apples or too many legumes like beans and things like that, those would be under the low FODMAP diet. Now, there is a good resource on the Monash website, and they have like exactly what you can and can have. So when you're doing the low FODMAP diet, you'd want it to be a short term. Okay, so if anybody's just joining us, hi and welcome. This is the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. If you're new to the channel, make sure to subscribe, make sure to like the video. Thank you, I really appreciate that. And we're now talking about IBS, but if you have any health questions or any concerns that you have, feel free to drop them in the chat box and I will answer them for you. So in terms of remedies for IBS, we got the low FODMAP diet. Just gonna erase that. The other thing that can be really helpful that's been studied for IBS is peppermint oil capsules. So I'll write that one down. So peppermint, it's basically peppermint extract or peppermint oil in a soft gel, and then you would take this daily. And it has been shown to help with reducing cramps, bloating, like if you're feeling twisting and spasms in your intestines, it can be really good. Peppermint oil is really helpful for IBS. So, okay.
Mayank Sapra has a question. I just eat one meal a day. I am looking for anti-aging diet. Please share a routine for aging gracefully. I am 37 years old.
Okay, so you're just eating one meal a day. So one thing I would say if you're eating only one meal a day, to make sure that you're getting enough calories still. Like that's probably hard for one meal to make sure you're meeting your calories in a healthy way. So just being mindful of that, because generally with one meal 3 times a day, every meal would probably have around like 500 to 700 calories, depending on how many calories your body needs. So if you're having one meal, you might be having like 1,500, 600, 700 calories in that one meal. So you have to make sure you're meeting your calorie intake. The other thing I would say for anti-aging is considering antioxidants and polyphenols. So these are compounds that are found in usually more so fruits and vegetables that are really good for supporting your cell health. So whenever we're thinking about longevity, we want to support our cellular health from a cellular level. So berries, kiwi, apples, those are really good sources of it. And then think about vegetables that are really dark and pigmented, red onion, red cabbage, beets, pomegranates, those are all going to be really good and healthy and supportive. And then, of course, making sure you're getting enough protein, because if we're thinking more so about skin health and hair, we need protein to make up those nutrients. So making sure that you're getting enough protein through your diet. Again, if you're having only one meal a day, you're going to have like probably 100 grams of protein at that meal, and then that might be a lot on your digestive system. So I would say, like, if it works for you doing the one meal, but you may need to do 2 meals and like splitting that up, doesn't necessarily mean that having 2 meals is going to be detrimental to your health. Having 2 meals and then doing like a 18-hour or 16-hour fast, you could still do that, and that would be beneficial.
He followed up with, I have very bad sleep cycle and I'm unable to sleep. My screen time is high as I'm an IT professional. What should I do?
So then that's definitely going to be contributing to oxidative stress in the body. So sleep is so important, so huge. So definitely trying your best to avoid your screens or limiting the amount of time that you're having on your screen. So you don't want to be using screens at least an hour before you're going to bed, because that's going to interfere with your sleep-wake cycle. So something that you can do during the day when you're on your screens is use like the blue light blocking glasses, or you can even get like a filter to put on your computer, on your phone as well. So that I would highly recommend doing something like that. And then in the morning, before you go on your phone or your computer, try to get some exposure to sunlight. So go out. I know it might be hard if it's dark in the morning, but if you're able to get some sunlight in the morning, that would be great. That helps to regulate cortisol. And then if you can't get sunlight in the morning, you might need to buy a light box. So there's these specific things called light boxes that give off like what sunlight would give, in terms of helping with regulating your cortisol cycle.
Ben asks, I want to be able to weigh 180. I'm 5'5" and I weigh 210. Although I don't mind my current weight because I feel good. I know it isn't healthy.
Okay, yeah, that's a great question. So if anybody's just joining us, hi and welcome. Thanks for watching. I'm Dr. Amanda, naturopathic doctor. This is the Let's Talk Health live stream. We were talking about some gut health concerns, but now we've got some great questions. So if you're new here, be sure to subscribe, be sure to follow my gut health community and my health community, and like this video. It really does help. So if I've answered a question for you and it was helpful, or even if you're just watching, make sure to like this video. Okay, so we had a question from Ben about diet or about weight. So some things that you want to do is just assessing your eating habits and your lifestyle habits. That's really what it comes down to when it comes to weight loss, is just being more disciplined, being more consistent. Consistency is huge, and addressing those diet and lifestyle things. And by lifestyle, I mean things like exercise, stress management, and sleep. So when you're looking at diet, think about or just assess what you are eating on your day-to-day, and generally just by reducing your calories, even if you reduce your calories by 100 calories at each meal, that will help you with losing some weight. Or choosing foods that are more nourishing and whole foods, rather than things that are going to be packaged and processed that aren't giving you any nutrition, but they're contributing to your overall calories. There's another thing that we've talked about before, intermittent fasting. So if you haven't watched any of my talks before, when I talked a little bit about intermittent fasting, that has been shown to be helpful with weight loss and insulin and blood sugar regulation. So for intermittent fasting, and maybe I can write this down too, but you want to be fasting for about 16 hours, and then you would eat for an 8-hour window. But what I usually recommend when you're doing this intermittent fasting is, a lot of times people they'll skip breakfast and then they won't eat until 12, and then they eat from 12 to 8, but that's actually not the best way to do that. You want to try to avoid eating late at night. So maybe you're only going to eat from, let's say, 10 to 6. That would be a better window of time. So doing something like that. Was there any follow-up questions that you had? just going to erase all this. And let's write down about intermittent fasting. Okay, so...
Is it, you're going to...
No, go ahead.
You're going to write about...
Ask the question.
Talk about intermittent fasting.
Yeah, ask the question. No?
It's a different question.
Okay, let's write down a little bit about intermittent fasting. So usually there's different types, but one that's popular is called the 16-8. So that's where you fast for 16 hours and then you eat for 8 hours. So for example, 10 a.m. to 6 p.m. is your eat window. Now, when you're fasting, all you really want to have is water. Like water, making sure you're staying hydrated, try to avoid anything else. And that can be helpful for regulating blood sugar for weight loss as well. And then looking into, again, what you're eating in your diet. So, okay. So if you're just joining us, thank you. This is Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. We talked a little bit about intermittent fasting. We talked about IBS. We had some great questions so far. So feel free to drop any questions that you have in the chat box and I'll answer them for you. Okay.
Is it true that sea buckthorn seeds powder can stop the aging process?
Sea buckthorn powder?
Yeah.
That I'm not too sure. I'd have to look to see if there's research about can sea buckthorn stop the aging process. Honestly, from what I know, we can't stop aging. It's our natural course of life. We're going to age. There are things that you can do to help with aging more gracefully and things that you can avoid. Like, for example, smoking cigarettes is horrible for aging. It will age you way faster in many different ways, physically, the way you look, and internally. So that I would say something like that, avoiding alcohol, anything that can really cause damage to the body. Whereas focusing on things like we talked about, some good nutrients in your diet, vitamins, minerals, vitamin D, all of these can be very helpful for helping you to age more gracefully. So potentially sea buckthorn could fall under that category, but I wouldn't say that it would stop aging.
Dr. Morelli, other than potassium deficiency, what are some of the other culprits that may attribute to migraines?
So it could even be magnesium deficiency, but with migraines there can be so many things. So if you have a period, if you're cycling, it could be hormonal related, so that's one thing to consider or look into if that's, if you're having a period and you're cycling. The other things could be tension, so muscle tension is a huge contributor to migraines. If you're getting like a lot of tension in the upper neck and upper shoulders, can cause a lot of pressure and can contribute to migraines. What else can contribute to migraines? A lack of sleep, or lack of a proper deep sleep. Maybe there's sleep apnea present where you're not getting enough oxygen to all your cells. That can contribute to migraines. Weather changes in the barometric pressure. So if you live somewhere where the weather is not consistent and you're getting a lot of humidity, or if you're getting a lot of rain, that can also contribute to migraines as well.
Can you sleep too much?
You can oversleep, yeah. I think with sleep, everybody has a different threshold of what they need, but generally for adults, like 7 to 8 hours is pretty good, like average amount of sleep that you want to get. But you could sleep where you oversleep too much, and then you could feel actually groggy and tired from that. Okay, so if you're just joining us, hi and welcome. This is Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor, here to answer any health questions you have. If you haven't subscribed already, be sure to subscribe on YouTube. I'm also on TikTok and Instagram, so feel free to follow me across all those channels. I do go live every day, so you'll make sure you get notified. If you're subscribed, you'll get notified when I go live. And then of course, like the video. I really appreciate it. If you could like it, it does help a lot with getting my video noticed. So.
Rap Ninja Culture asks, what do you think about music helping with my mental state?
I like the name, rap ninja culture. Yeah, I think music is so good. I think that some people, I mean, everybody's different, but I think that it can be very therapeutic, it can be very helpful for mental health. Um, that being said, everybody's preference is different. So maybe for you, what works for you doesn't work for somebody else, but it can be very helpful, therapeutic. Um, Arts and crafts and all that kind of stuff as well. So not just like music as an art, right? There's different forms of art.
Like the Bristol board behind you.
Like the Bristol board, yeah. So, some people find doing things like puzzles and painting can be very therapeutic and good for mental health. So I like that question, but yeah.
Some people find it acoustic.
So yes, acoustic instruments, right? Like playing the acoustic guitar, that can be very helpful as well. So
acoustic being acoustic. Thoughts on OMAD?
I'm not sure what that is. Yeah. 1 meal a day. I think that's what that is. Just please clarify. I'll do my little intro, but if it's 1 meal a day, let me know. So if anybody's just joining us, hi, this is the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. We're talking about different types of health concerns here. People are asking me questions. So if you're new here, make sure to subscribe and like the video. Did they answer if it's 1 meal a day? I think it's 1 meal a day because I saw that on, was it TikTok or Instagram? So, I don't know if there's enough research on that to show if it's beneficial. Personally, I wouldn't recommend it, like just having 1 meal a day. I think that we were kind of talking about this before. I think it's hard to meet all your nutrient goals in that 1 meal. If you can, then that's great for you. Like if you're able to get all your protein and fiber and fat and all your vitamins and minerals in that 1 meal, which I think would be very challenging because you have to eat quite a bit. Maybe you're eating increased volume of something. Then maybe that would work for you. But I think for most people, having 1 meal a day, you're not going to meet your macronutrients and micronutrient goals. So that's something I genuinely wouldn't recommend doing. But, maybe if you're doing that, let us know. How are you meeting those goals, or what are you eating in that 1 meal? Yeah. Okay.
How bad is Zyn? It's chewing tobacco.
Oh. Okay. It has nicotine in it?
Oh yeah.
Okay. I'm not familiar with Zyn. Never heard about that. So when you're thinking about chewing tobacco, not only are you getting like the same effects of tobacco, but then you're also affecting your oral health way more, right? Like smoking, yes, will affect your oral health, but if you're actually chewing it, that can definitely impact your oral health, and that's something I would be cautious of. Because a lot of times we forget about how important our oral health is. We have to brush our teeth, we have to floss, make sure there's no bacteria in there, because our oral health is actually connected to the rest of our digestive system. So, your digestive system actually starts within your mouth. You have a microbiome in your mouth, so you're probably causing an imbalance of that good gut bacteria.
So are you for or against Zinmas?
What?
Are you for or against Zinmas?
Is that like Christmas but with Zyn?
Yeah.
I've never heard of that. So what is that? So are people just chewing tobacco for Christmas? I would say I would be against that. I'm not really a fan of tobacco and those kind of products. I think it's just something that it's not necessary, it's not needed, and it's gonna cause more harm than anything.
Are there food items which act as natural sources of nootropics or NZTs for increasing brain power, laser focus, cognition, and concentration? My attention span is severely declining. Please advise.
Mm-hmm. Did they say food supplements? What was the question?
Are there food items which act as natural sources of nootropics or NZTs?
Yeah, so one thing I can really think of would be green tea. I know it's a food, it's more of a drink, but green tea for sure can help out with the cognitive health, and that's because it contains L-theanine in it. I talked about L-theanine the other day or the day before. Really good for improving mental clarity, not making you sleepy, but also supporting relaxation. So I would say definitely getting some green tea. I usually like recommending green tea over coffee, because the caffeine level is a little bit lower. It usually doesn't cause like that anxiety and jitterness that coffee would do. So that's one thing I would recommend. The other thing would be herbs, using herbs and spices when you're cooking your food. So things like cinnamon and cayenne pepper, they're very good, very stimulating, good for getting like cognitive health support. Cayenne can also help with blood flow. So when we're thinking about a nootropic, we want to support that blood flow throughout the body, throughout the brain. What else? I talk about berries so much, but berries honestly are really, really good superfoods. So I would say having some berries as well.
What should we do for, or hold on.
So if you're just joining us, hi and welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. This is Let's Talk Health, where we have a health Q&A live chat together. I do my best to answer your questions, so drop them in the comments. If you're new here, make sure to subscribe, make sure to join our health community, and also like this video because it is really helpful, so thank you.
Famous celebs are following OMAD lifestyle. They say it's their secret of looking in their 30s or 40s when they're actually in their early 60s. Is it true?
You know, I wouldn't believe that. I think celebrities have access to so many different things, like, for example, Botox or different types of plastic surgery where we can't even tell. Ozempic is another huge one as well. So I'd just be cautious with seeing what celebrities say and what they're doing. Adrenochrome. Yeah, so many different therapies that they get, probably stem cell therapies to make them look younger as well. So just be cautious with what celebrities do. You know, again, with the 1 meal a day, if you try it out and it works for you and you're able to follow it properly with any sort of fad diet, or just any sort of diet really, you have to be careful with how you're doing it and how you're going about it. So.
What should we do for good memory?
So for good memory, let's talk a little bit about herbs. So one really good herb for helping with memory is Bacopa. So Bacopa monnieri.
Spell it.
Good comment. Bacopa. Herb for memory. Yeah, so Bacopa is a great herb for helping with, can you see it? With memory? Yeah. A lot of people that are studying, like students, really like to use this one. That's kind of where I learned about it in naturopathic school. It can help with supporting memory, so that's a really good one. Another one is ginkgo. Ginkgo is another really good one. So basically these herbs help with supporting blood flow in the brain, help with cognitive connection between your cognitive cells. So those are some really good ones that can help with supporting memory. Another really good thing is exercise. So if we think about exercise, we're getting good blood flow through the body. So even if you're doing a short HIIT training or sprints or cardiovascular, that type of exercise is going to be beneficial as well. Did I answer that question fully?
I think so.
Okay, so if you're just joining us, hi and welcome. This is Let's Talk Health. I'm Dr. Amanda. We have a live Q&A here. So if you're new here, make sure to subscribe and join our health community, and then like this video. I really do appreciate it. So thanks for joining. Any questions that I haven't answered?
Oh, there's some audio issues, it looks like.
On our end?
Well, let's just continue. Do you recommend taking supplements or medicines increasing brain power like Lion Mane or other supplements which are being sold as brain boosters online?
Yeah, so that's a good question. Lion's Mane is another good one too.
Hold on, it says the video's frozen. I'm just going to end it. Start again.